Hey guys, Justin Moore back with Anton here again for Parabolic Performance and Rehab. And what we're going to show you is a 90-90 hip lift with right arm reach, which is going to be a early exercise or an early activity we use to drive some trunk rotation through the thorax. And so what I'm going to have Anton do is set up with both of his feet flat on the wall. I'm giving him a foam roller there, not to necessarily dig down excessively, but to just have a little bit more of a reference to his left heel than his right heel. Step one is I'm going to have Anton just reach his knees towards the ceiling to get a little bit of a tilt to that pelvis. So he's trying to keep his lower back flat, but he's trying to engage some hamstrings to posteriorly rotate that pelvis. He's squeezing the ball to get some adductors. And now what we're going to do is we're going to have him take an exhale and reach his right arm towards the ceiling. And the cue I'm going to give him is a long, slow breath out and then fog up glass. And reach a little higher. Keep reaching, Anton. Good. So that right arm, imagine you are a bus driver and you are trying to turn the wheel on a bus to the left. That's what that right arm is doing. So exhale, straight up reach, and blow out. Good. Keep blowing. And if you can watch, you can see that left rib cage really diving down, in and back. He's getting his thorax to translate in the frontal plane to the left via that right serratus anterior. That is allowing his abs on the left side to pick up leverage and to give him a zone of apposition and internal rotation of the left rib cage. Through that, he is then going to hold the reach, take an easy breath in through the nose, a silent breath in, and that silent breath in is going to have to fill his right apical chest wall because he has active abdominals on the left side. So we're using that right serratus anterior in a good pelvic position to drive internal rotation of the left ribs and frontal plane trunk movement to the left, which is then going to give us triplanar movement of the trunk to the right, okay? So when left ribs come down in and back like they are, he's then gonna take his breath in, and that air is gonna have to go into the right chest wall, which is opening up those right ribs. And we know that when we rotate our trunk to the right, we get external rotation of the right ribs and internal rotation of the left ribs, which is actually what we're driving with this right reaching activity.